Hi everybody, I'm Ken DeFontes. I work at Towson Orthopaedic Associates as an orthopedic surgeon specializing in lower extremity, foot and ankle, and also sports medicine. So I chose to become an orthopedic surgeon, basically after my rotations in med school, decided that, obviously it was an exciting field and also, really able to help people, kind of get them back to the quality of life that they want and enjoy. I knew I wanted to be a surgeon, but, really throughout some of my rotations is when I finally decided that orthopedics was the field for me. So I was born and raised in Kingsville, Maryland. My parents still live in the same house that I grew up in. I obviously went to local public school here, did get away a little bit for college at William & Mary, which was really nice, and then came back for med school at Hopkins and stuck around for my training at Union Memorial, and also did some time down at Shock Trauma. So, and after that, one more year up in Boston, then decided to come back for a job. I found that in orthopedics, especially when I did my rotations in med school, that, you really, get to help people in terms of, directly, like, and there's an outcome that you can see, and you can, take somebody who can replace their knee or fix their Achilles tendon and kind of get them back to a quality of life that they enjoy. And so I think that that's, a very satisfying aspect of what we do and why I decided to go into orthopedics. I love being able to help people, especially in the lower extremity world and foot and ankle world, where, people have trouble walking, and being able to get them back to quality of life is very, very satisfying. Again, you use your feet and ankles all day long, and so, being able to see the direct result of that is very helpful. And obviously working with people in the community that I grew up in is really nice. TOA is a great institution and a great practice. We've got very high quality surgeons that really care and are invested in the community. We have basically all different specialties. We're all subspecialists. Almost all of us are fellowship trained, and so if you come in to see me and then you need to be seen by a hand specialist, we'll get you right over to somebody that can take care of your hand as well. We have a big involvement in the community with Towson Sports Medicine and our involvement in covering the sports teams and things like that. So I think it's a great area to come and get your care. And obviously St. Joe's is a great hospital to have surgery. I think what really sets us apart, not just the physicians, but the nurses, the staff, everybody that comes together to take care of our patients. And in the St. Joseph Medical Center, we really do care, and people are willing to kind of go the extra step, to really do what needs to be done for the patient. And I think that's something that is definitely highly valued.